no matter what. I'm feeling great.
Om Shanti and welcome back to our meditation special series on Light of Knowledge. In this episode, we are going to talk about professionals, about doctors. We look at doctors as heroes, someone who saves our lives, someone who alleviates our pain, and someone who's a healer. They get paid handsomely for this, but people who go into this profession go in it because they want to give back something to the society. This also comes with their own share of stress and pressure. So let's find out from our guest, Dr. Donika, who is also a doctor herself, how can meditation help doctors? Welcome to the show, Dr. Donika.
Thank you. Om Shanti.
We are going to discuss something which is something very close to your heart, something you can relate to, which is doctors. Doctors are the backbone of our healthcare system, but they also have a code of moral ethics. And I was wondering how a meditation process can help the doctors, because there will be times when doctors will be faced with this issue in their life, in their career. So I'm sure a meditation practice background can definitely help doctors when such a situation comes up.
Yeah, definitely, sister. What we need to introspect in ourselves is there is a very minute line between the morals and ethics. As you said, ethics, first of all, we have to introspect with ourselves that whatsoever we are practicing, the behavior we have with our patients, their family members, and the way of my practice, is it really satisfying me morally? So that the upper level, that comes the ethics, that it is at a higher range, that now we are at a self-esteem and we have that balance within us, that yes, what I am practicing, I am totally satisfied with it ethically. And along with that, meditation has that power, which we can say that which adds an engine to the process, that whatsoever I am practicing in, the way I am practicing, the way I am behaving with my staff. Because you see, as a doctor, I have multi-focus. I have to come in relationship with the patient, the families, the staff, and all the things, paramedicals, you can say the pharmacists, lab technicians. These all things I have to balance within me, and meditation has an inner power which gives me the stability for all of this.
So when you say the code of moral ethics, it deals with your relationship with the patient, and as you discussed, your relationship with your staff, and also when it comes to diagnosis. So these are all the factors that a doctor has to deal with in his career. And this is where you were saying meditation practice can benefit doctors to a great extent.
Definitely. What we are seeing today, that a doctor himself says that I am today depressed because some of the circumstances have made me so. It may be his family background, it may be some ups and downs in the staffs, or he may have been poked up by the patient or the relatives where an instability comes. So it becomes, first of all, my duty to find out that am I stable, because what I as a doctor preferred to, and I am also practicing till yet, that whenever I have to sit before practice or whenever I have to treat any patient, start my follow-ups or start my consultation, before that I just have to sit up and find out myself that is there everything which is going on, the outer atmosphere and my inner stability at pace with each other.
Okay, so this is very beautiful. Before you start treating the patient, you have to go within and find out for yourself how I am feeling. Am I in a position to give to the society for which I'm sitting in this chair? So that's very beautiful. Would you be able to lead us and our doctor friends out there into a meditation?
Yeah, sure, we can. We can sit straight with the eyes open. Let me ask myself that I'm at a role as a doctor. Now, when I see myself on a role as a doctor, let me introspect my whole schedule from morning to evening or till night, the way I am coming in connection with my staff, with my patients and their relatives, the other paramedical staff. Am I at balance with all of them? Or is it so that the situations, the behavior of the people, the manner of their talking, are they disturbing my consciousness? Let me find out myself. What are those factors that are disturbing me, distracting me, making me depressed or angry? Introspect. Let me today make an illumination within me that what I was thinking, the factors, the environment, the circumstances, patients, staff, what I was thinking, they were distracting or disturbing me. Let me give an illumination that it's not they who are distracting me, but my inner instability, my unstableness, it's making me distracted. Make myself aware that I am a stable being, at peace with myself. So today, when I sit for consultation, OPD or IPD, I have made my realization that I am at peace with myself. So whatsoever the situation comes, I will be handling them with peace and ease. With peace and ease. This feeling is making me peaceful. Can come back to the normal position as we were previously. Om Shanti.
Thank you, sister. I can just feel the difference here already. I can just imagine when you're sitting in your clinic waiting for patients, you do this practice a few minutes before the patient comes in. And I can see that the atmosphere is going to be already charged.
Yeah, definitely. When I am speaking about this, it's not only me who is practicing. I have got many follow-ups or many feedbacks, we can say, from the persons who are practicing this, because in Brahma Kumaris we have 20 wings under Raj Yoga Education and Research Foundation, which is the sister concern of Brahma Kumaris. And under those 20 wings, medical wing is one of the active wings.
Okay.
And we have many doctors under it, and who are taking its benefit. They are regularly practicing meditation, and they themselves can feel and experience the change.
Okay, so you've definitely received positive feedback with this technique.
Yeah.
Oh, that's wonderful to know. Doctor, as a patient, I'm just thinking, I'm a patient and I have my ailments, I have my disease, problems, whatever it is that I have. I walk into a doctor's office And I know my side of the story, and I kind of wanted to know the other side of the story. How does the doctor look at a patient when she or he first walks in through the door?
Oh, that's definitely a good start. We can say there can be two perspectives. First perspective is when we look as the patient as the body. What we are seeing today, when we look the patient and his relatives as the body, here we see that how much are they going to expend, or how much can they expend for the treatment. Now what we are seeing is sometimes there has been an added professionalism in each and every profession. What initially I myself remember when I had taken the admission for my medical course, and it was my first initial practicals, and one of the teachers, she just asked a question in the practical that why do you want to become doctors?
That's right, the primary question, right?
The primary question was asked, why do you want to become the doctors? And some of the answers were to come back, and before that, knowing the situation, the professor just poked out that please don't tell me that you all have to do social service.
So it's become a cliche.
Yeah. So what I basically think that today what has been this profession brought up is as a professionalism. It's not that we are showing some sympathy or we are looking at compassion. We are looking the patients with compassion, but where the professionalism and the body consciousness comes, the first thing when the doctor looks at the patient is how is his outlook? How does it look like? Is he able to expend more, or is he a very average one? But I think there is one more perspective which meditation and spirituality can definitely bring into, is the compassion.
Oh, that's very needed for a doctor.
Yeah, and that makes the profession a noble profession. With which thought he is coming to the doctor. You know, doctors are called as next to God. Why are they called next to God? We know God has compassion for all the humans, all his souls, all his children. But when we see ourselves as a doctor, patients are giving us the position next to God. So are we creating that much compassion for them?
That's very important to remember, I think. If the patient is putting you on a pedestal, then it almost comes back to the doctor where the patient has to be treated the same way. And I recall, like, I don't go alone to the doctor. You know, there will be somebody accompanying me. So the person who's with me, whether my husband, my family, my parents, they will also be a little nervous. They will also have that fear or, you know, the anxiety. So maybe there are like 3 or 4 people at a time coming into the doctor's office. Sometimes that happens too.
With what case or with what problem they have come? You see, there are 2 bases of the treatments when the patient comes or approaches to the doctor. One is the acute one and one is the chronic one.
That's right.
In acute one, sometimes the patient himself is so very, you can say, anxious that his anxiety, his pain, severe pain he is having, the severe mental instability he is having,
That's right.
that somewhere or the other creates an impact of pain on the relatives also. So the relatives, they are also very anxious, and they come to the doctor with all the whys, what, when, how much time for the treatment, number of questions that is my patient or is my relative going to be healthy as he was before, or there may be any complications, because the acute cases are the ones where they have no idea or they are not mentally prepared at all.
That's right. And also I was going to add that in this digital age, we see this happening more and more, where people, before they step into the doctor's office, they're educated themselves. So they go online and they will try to, because this has happened to us a few times, where, you know, we try to diagnose ourselves. And when we walk into the doctor's office, it's not that we don't trust the doctor. It is just our own anxiety to know what is happening to me. So I'll tell the doctor, okay, these are my symptoms, but maybe this is what I have, you know, and the doctor is, okay, let me do my job, you know.
So here, what spirituality or meditation will help? Say, for example, if you are having pain in the abdomen, you will have number of differential diagnoses.
That's right.
that it may be an ulcer, it may be appendicitis, and from A to Z you will have from number of complications you will be seeing.
That's right.
So that means you are at the very higher peak of anxiousness and stress or tension, and you want the doctor first of all to give you relief psychologically.
That's right. That's very important.
And that's the very basic role of the doctor, ethically speaking. He can see the case, and if he also supports the patient that, oh, these all can be the complications, so where the patient is already in a nervous state, he will land up more nervous. So as a doctor or as a healer, I can say, my first role is to heal him psychologically as well as physically. I should make him at peace so that he can be stable, because we see when there are number of questions coming into our mind, when there is a higher stress level, the pulse rate, the blood pressure, all will be at the higher level.
Right.
So these cases, somewhere or the other, they are affecting on the other aspects of the body too. When we say in spirituality, there is a new concept, we can say in Brahma Kumaris, what we have been given a blessing from God, the Supreme Soul over here, that the doctors are double doctors.
Oh, that is such an interesting term, and I would definitely like to know, and I'm sure our viewers too, what that means.
When a patient approaches us, the first thing we look at him as a patient. So that is the look as a patient, means we are treating his physical ailment as well as we are treating somewhere or the other the patient as a whole. As a whole means the second aspect, that is the second double part we saw. The first doctor as a physical doctor, what ailment he is having, we want to give treatment for that thing. And this other consequence, the second consequence is I look at the patient when he enters into my clinic or my hospital as he is a spirit, that is, he is a soul.
Okay, so I can just see from, having your influence all these episodes by interacting with you, that immediately when the doctor goes into soul consciousness, I can immediately see how the patient is going to be positively influenced. And if I may, I'd like to just cite one example. We have a doctor, he's also a doctor of homeopathy, and whenever we go and step into his room, you really feel this. So I'm experiencing what you're talking about, where you really feel that he puts you at ease.
Yeah, that's it.
And he starts, with common talk first. He doesn't go directly into our condition. And he himself has said that he has also received a lot of feedback that, more than treating the physical aspect, he's treating the soul aspect.
That's very true, because homeopathy itself is treating the patient as a whole. But looking at the previous aspect, what we were talking, and as you said, he doesn't look at the patient as diseased. Now, disease, this word itself, when we break into, it is dis plus ease. That is, we are not at ease with ourselves. When the body is not at ease with myself, the second uneasiness come into my consciousness, that is, I as a soul am somewhere or the other not at ease with myself. The role of meditation over here and the role of spirituality, when the doctor looks the patient, when the doctor looks at the patient as a whole, that he is a soul residing in this body, that stage of looking or that consciousness of looking somewhere or the other makes the feeling come into myself that I have to give him compassion, I have to give him peace, and I have to make him stable at both the aspects, treating his physical as well as the soul.
That's right. So that's where the healing begins, and the doctors stay true to their duty as a healer.
So here we get the differentiation that now I have to look at the patient not as the body or how much he is going to pay me. You see the basic difference, what we are looking when professionalism comes, that what he is to give me. And when the vibration of getting comes, there my energy is depleted.
I just thought of something when you mentioned that sometimes it does happen when you go to doctors or hospitals. They will first ask you if you have a medical insurance.
That's it.
And that I think has become common practice, I'm not sure. But even that sets a different tone in the treatment, right?
Very true. rather I am seeing number of hospitals, they are linked with this insurance persons, and whenever the patient enters into, even I once had been with a relative, and the first question was, do you have an insurance? Immediately I got the energy that they are in the energy of getting and not the giving.
Right.
Though the hospital was a renowned one, I didn't fit it, that I didn't find it good one, because where the energy is of only getting and not giving, there the energy depletion is there and not the energy of compassion. We can't get that energy at all. So here, when we think as givers, we are not as takers. We have to give for it. Yeah, it's a profession through which we can say, it's a humorous thing that through this profession, we are treating the patient, but we are earning through it. But somewhere or the other, it's not that we are only earning, but we have to make that patient at rest, at peace. So here, I have to change my thinking pattern, my thought pattern. When patient enters into my cabin, I don't have to give him the energy of getting what he is going to give me, but first I have to give him the energy of compassion, and that energy that I am going to heal him as a whole.
Doctor, I was also thinking about, the social commitment of doctors. I believe, I'm not sure if it is during your 4 years of college or if it's during the residency, but there are times when the doctors have to do some rural service area. So even that comes into the same principle, or in line with a doctor's duty is to serve. Because as I understand, maybe in the rural areas, the conditions might be a little different. So how does that play into the life of a doctor?
Considering the Indian aspect, what the pattern is going on currently, that the first 5.5 years is the medical studies. The 4.5 years is education. 1 year is internship in the same college which we are studying. And now the government has come with an approach, because what is seen is majority of the population resides in the rural areas. But in rural areas, there are no such equipments or not much facilities, and even many of the times no doctors to treat them. So the government has taken this aspect into consideration, and for the betterment of the people staying in rural places, they started a scheme that the doctors have to make a bond. They shall practice for 2 years into the rural areas.
That's very good, because if a doctor has the possibility, maybe he can extend his 2 years to 3 years or 4 years, and that will give the added help which is needed in the rural areas. Doctor, once again, we are short of time, and we would definitely like to continue, because there are many more aspects to be uncovered, and we would definitely like to continue this discussion with you and get your insight. So please be with us, and thank you for this episode.
Thank you. Om Shanti.
We had a very wonderful discussion about a few issues, and there are a lot more issues that we can touch upon and find out how meditation can bring the balance and peace which the doctors may need at times, because they have their own stress and their own pressures, and like everybody else in life. So hopefully we'll continue this episode, and please come back, because we would like to have your input on this. And as always, if there is any feedback, any questions or concerns, please don't hesitate to write to us. We'll see you again. Till then, thanks for watching us.